name is Sabiha. I'm going to be doing the validation for the bed bath and also the bed making. The first thing I'm going to do is check the physician's orders, wash my hands, gather my equipment, come into the patient's room, introduce myself, identify the patient, explain the procedure, and also provide privacy. So I have all my supplies over here, and I have my gloves. So I'm going to come up to the patient, half the patient up to my working height. I'm going to put the side rail down. I'm going to wash my hands and I'm going to put on my gloves. First thing I'm going to do is cover the patient with the bath towel, bath blanket. So my basin is going to be filled with warm water, whatever the patient's comfortable with. And I'm also going to have this towel, I'm going to make it into a mitt. So I'm going to wet, and I'm going to go from inside of the eye to out. The same on the other eye. I'm going to wash the cheeks, the ears, and then I'm going to dry. Now I'm going to do the arms. I'm only going to expose the arms at this point. I'm going to wet. I'm going to clean from the fingers upward into the axillary. Then I'm going to dry. And I'll be doing the same thing on the other side. So I would do the same thing on this other side. Now I'm going to do the chest area. So I'm only going to expose the chest. Okay, now I'm going to use soap and water, warm water from the chest down. I'm going to be using soap and water, but for the face, it's just going to be lukewarm water that the patient is comfortable with. So I'm going to rinse. I'm going to clean the chest beneath the breast, both of the breasts, around any IVs, and check if all the IV sites are okay. I'm going to be doing the abdomen part. So I'm going to be taking off the gown underneath with the linen that would go away. And now I'm going to do the abdomen. So I would rinse and wipe around any tubing and clean it. Then I would dry it at that. Now I would move on to the legs. I'm going to cover the abdomen part. I'm going to expose one leg. go from the feet in between the toes and up all around. Then I would dry. Make sure that the toes are very dry and in between. And I would be doing the same for the other leg. So now I'm going to do I did the legs, now I'm going to do the perineal area. Before doing that, I'm going to change the water and also the cloth, the washcloth, and also my gloves. I'll wash my hands and put new gloves on. So before doing that, I'll cover the legs for the patient. I'll only expose the perineal area. Okay. So I have new water with soap, and I have new gloves and new washcloth. So I'm gonna clean the perineal, and I'll be going, if it's a female patient, I'll go from the front back, and I'll wipe around, and then I'll make sure I'm drying the patient. I'll cover the patient back up once I'm done. Now I'll be doing the patient's back. Before doing that, I'll change the water and the washcloth once again with, I'll have warm water with soap. So now I'm going to turn the patient to the other side. I'm going to cross the legs. Use the shoulders and the hips to turn the patient. So I got new water, and now I'm going to wash the back. Wash the back. And I can assess the patient at this time. And I'll wash the buttocks, once again, from front to back. And then I would dry the patient. I'm going to bring the patient back. Now I'm going to put new gown onto the patient.
What position do you want that? What position do you have to have done?
Okay, so now the gown is on the patient, and I would put on any deodorant. I'll put on the deodorant and put on lotion on the legs, on the hands, whichever they prefer. And I'll lower the bed in lowest position, put the side rails up, and in the next video I'll be changing the linen.